Hello, my name is Dr. Shweta Shah. I'm a consultant gynecologist and laparoscopic surgeon attached with Cloudnine Hospitals at Malad, Mumbai. First of all, I would like to wish all of you a very happy Diwali and a prosperous New Year. Today we are going to discuss on fibroids and their role in fertility. Let us first understand what are fibroids. Fibroids are growth which arise from the muscular layer of the uterus. They are very slow to grow and they never turn into cancerous. Now, the other things related to the fibroids are which women are at risk of getting fibroids. Now, there are three most common risk factors for fibroids, which include women who are obese. Secondly, a very important thing is a family history of fibroid, a very strong family history of fibroid. And third is the women who has never borne any child. These three are the most important risk factors when we are talking about fibroids. Now, what are the types of fibroids which hamper the fertility aspect in a woman? Now, we have two types of fibroids. One type is known as a submucous fibroid and another one is known as an intramural fibroid, which impair the fertility in the women. Now, what do you mean by a submucous fibroid? A submucous fibroid is a one where the fibroid will grow in the endometrial cavity where the baby actually implants during pregnancy. Those fibroids are known as submucous fibroids. Now, another type of fibroids which impair fertility are known as intramural fibroids. Those fibroids are away from the endometrial cavity. They are only lying in the muscular layer of the uterus. Now, as we know about all these things, let us now try and understand that which fibroids actually need treatment and do all infertile women with fibroids need treatment. Now, after we have evaluated the couple, the male as well as the female partner, and once all the test reports have been reported as normal, and if the couple has been actively trying for a period of 1 year and still they have not able to achieve the pregnancy, in spite of doctors' efforts, is the time when we as doctors decide to treat the fibroid. So, any couple who has been trying for pregnancy, hasn't achieved the pregnancy within a span of 1 year, has been evaluated for infertility with all reports being normal and in spite of doctors' help haven't been able to conceive, are the candidates where the fibroids need to be treated. Other conditions where the fibroids need doctor's attention or medical attention is any couple who is undergoing an IVF, that is an in vitro fertilization procedure. Before that, we would ideally remove the fibroids if the woman is diagnosed with them. Now, let us understand how can we treat these fibroids. Okay. Now, fibroids unfortunately have no medical line of management and we have to treat them surgically. Now, there are different modalities of surgery where these fibroids can be dealt with. Now, any fibroid, any submucosal fibroid which is lying inside the cavity of the uterus and which is more than 3 centimeters definitely needs removal. We diagnose this by doing a ultrasonography, which is known as a 3D USG pelvis or a 3D scan of the pelvis, where we find that if the fibroid is pushing or entering into the endometrial cavity, irrespective of the size, needs removal. The other type which needs removal is an intramural fibroid, which is more than 4 centimeters, definitely needs removal. Before we decide to remove the fibroids, we do all the blood workup of the patient and a fibroid mapping, which is done by what I told, the ultrasonography of the pelvis, that is very importantly done before we post the patient or counsel for surgery. Now, there are two approaches by which we can remove the fibroids. One is a hysteroscopic approach and other is a laparoscopic approach. Now, what is the difference? A hysteroscopic approach means we have a telescope which is introduced through the natural orifice of the women, natural vaginal orifice of the women, and we use some micro instruments through the channel of the telescope, and under electric current we remove the fibroids. But this is possible only when the fibroid is found completely inside the endometrial cavity or a submucosal fibroid. This approach is not possible for an intramural fibroid. For an intramural fibroid, we can undergo a procedure which is known as a laparoscopic myomectomy, where we put in keyholes and we put in a telescope through the belly button and we remove the fibroids through the laparoscopic approach or a minimal invasive approach. Now this is a treatment of the fibroids, and before we discuss the treatment, I would like to let you know how fibroids can impair the fertility in a woman. Now, depending upon the size, the location and the type of the fibroids, the mechanisms by which they cause infertility include: first of all, they distort the normal anatomy of the female reproductive tract, and because of this distortion there is a difficulty of the egg and the sperm meeting each other, and this leads to infertility. It also causes something known as a fallopian tube block, where the egg and the sperm meet in the tube, and that fibroids may result in blockage of the tubes, and therefore it may cause infertility. The other ways by which fibroids can cause infertility is they hamper in implantation of the embryo by distorting the cavity. So these are the mechanisms by which fibroids cause infertility in a woman. Now, just the mere presence of a fibroid on ultrasonography does not mean that the fibroid needs to be removed. As I told you, the criteria for removal of fibroids are if all other parameters being normal, they have been tried to conceive naturally but have failed, or they have tried conception with the doctor's help, and in spite of that attempts the conception has failed, is the time when we take decisions of removing the fibroid. Now let us see, I have a lot of questions related to these topic, and let us address one of them. Now, first question is asked that can fibroids in the uterus affect fertility? Yes, I told you fibroids can affect fertility. How do they? These fibroids distort the normal anatomy of the female reproductive tract, and they hamper the fertility of the women. Next question is, how do fibroids affect fertility? Yes, so they cause something known as fallopian tube blockage, and this fallopian tube blockage will not allow the egg and the sperm to meet, and therefore they will result in fertility. The other problem they can affect with the fertility is that they cause distortion of the endometrial cavity, where the embryo has to get implanted, and that also results in infertility. Then it also causes excessive contractility of the uterus, which doesn't allow the embryo to implant. So that is also one of the reasons how fibroids cause infertility. Are fibroids hereditary? Yes. Fibroids are hereditary. There has to be a very strong family history. The women's mother, sister, siblings, anybody will definitely have a history of fibroids. So they are definitely hereditary. What size of fibroids can cause infertility? So as I told you, it is the location of the fibroid that is important. A submucous fibroid means a fibroid which is inside the endometrial cavity, inside the cavity where the pregnancy has to stay. If the fibroid is a submucous one, let it be any size, it has to be removed. For an intramural fibroid, where it is away from the endometrial cavity, the size criteria is more than 4 centimeters. Is surgery the only option for removal of fibroids? Yes. Unfortunately, fibroids have no medical line of management. We have to get them removed only by a surgery. There is no other way out. If fibroids run in my family, should I plan to have children sooner? See, if you have a strong family history of fibroids and if you wish to delay your family planning, then you at least have to get yourself checked regularly by doing an ultrasonography, which will tell you whether you have risk of fibroids or not. And if you ask me, you should not delay your child bearing issue if you have a history of fibroids in the family. Do fibroids cause infertility? Yes, I told you fibroids do cause infertility. How do they cause infertility? Is because of the distortion of the normal anatomy of the female reproductive tract, and it also causes distortion of the endometrial cavity. Plus, it also causes a foreign body reaction inside the uterine cavity where the pregnancy has to stay, which leads to implantation failure. So these are the factors by which the fibroids cause infertility. What size of fibroid can cause infertility? Again, the same question. It is the location of the fibroid. Submucous fibroid of any size can lead to infertility, and an intramural fibroid of more than 4 centimeters can lead to infertility. Next question is, what is the size and location of my fibroid, and can the fibroid affect my fertility? Yes, I have already explained you fibroids do affect fertility depending upon the size and the location. The two most common fibroids which affect fertility is the submucous one first, and the second is the intramural one. How fibroids affect my fertility I have already discussed, by causing distortion of the endometrial cavity, blockage of the fallopian tubes, not allowing the egg and the sperm to meet, causing a foreign body reaction in the endometrial cavity leading to implantation failure by causing inflammation. Do all fibroids cause infertility? No, all fibroids do not cause infertility. There is a variety of fibroid which is known as subserosal, that is completely outside the uterus, do not lead to infertility. The varieties which lead to infertility are mainly submucous fibroids and intramural fibroids. Should I remove my fibroids before getting pregnant? As I told you, see, I have always seen patients who have become pregnant with a fibroid. Now, it does not mean if you are pregnant and you have a fibroid, you need not remove the fibroid. You can very well continue the pregnancy up till term. There are few complications which can happen with a fibroid and a pregnancy. What are those complications? The fibroid may increase in size during pregnancy because of the hormonal support which they get during the pregnancy. There is something known as a red degeneration thing happening in the fibroid, where the fibroid may cause a lot of pain in the lower abdomen, but that pain can be managed symptomatically by giving painkillers. The third thing is, sometimes if the fibroid is big, it can cause a premature labor or a preterm labor, but that is very rare, but it does happen. So just a fibroid, if you have become pregnant with a fibroid, it does not mean that you have to remove the fibroid. You can very well continue your pregnancy with the fibroids. What is the risk of my fibroids growing back with each procedure? Fibroids are getting notorious. If the women had a single fibroid at the first place, the rate of recurrence is very low. But if she got multiple fibroids, then the rate of recurrence is very high. In whom it will recur, in how many years it will recur, there is no maths to it. But yes, the recurrence rate is very high, especially if a woman has a family history of fibroid and she was diagnosed with multiple fibroids in the first place. A woman with a single fibroid has a rare chance of recurrence, but still I have seen cases where even a woman who was operated for a fibroid, for a single fibroid 4-5 years back, had a recurrence of single fibroid again after 5 to 6 years. So recurrence rate is obviously high with fibroids. The recurrence rate definitely does not depend upon the procedure, whether you remove it laparoscopically or you remove it hysteroscopically. It is the tendency of a woman that determines the recurrence rate, especially if she has all the risk factors that I discussed earlier. If she's obese, if she has never born a child, if she has a strong family history of fibroid, if she had multiple fibroid at the first place. These are the important risk factors which may increase the risk of fibroids growing back. Definitely it is not procedural related. What are the treatment options? I told you, unfortunately, there is no medical line of management. You have only a surgical line of management for removing fibroids. There are two options. Either you can go through an hysteroscopic myomectomy or you can go through a laparoscopic myomectomy. Myomectomy means procedure to remove the fibroids only. Now, hysteroscopic is we will remove the fibroid through the natural vaginal orifice of the women. There are no scars given on the abdomen. We have a long telescope which goes through the vaginal end into the uterine cavity, and we use miniature instruments and electric current to remove these fibroids. But this is suitable only when a woman has a submucous fibroid or a mucus or a fibroid which is lying inside the cavity of the uterus. For an intramural fibroid, we have to undergo a laparoscopic procedure which is known as a minimal invasive or a keyhole surgery, where we introduce a telescope through the navel button and we remove that fibroids through the side miniature holes which are done into your abdomen. What type of fibroids prevent pregnancy? Now there are particularly there are no types which can prevent pregnancy. There are types which will hamper the fertility of the women, and the most common types are the submucous one and the intramural. Intramural is least likely to hamper pregnancy or the fertility aspect. It is mainly the submucous fibroids which hamper the fertility. Does removing fibroid improve fertility? Yes, I have seen cases where removal of the fibroid has led to a successful, spontaneous, natural conception. So fibroid removal does improve fertility because it corrects the distorted anatomy of the female reproductive tract to a normal anatomy, and this definitely helps in the conception part. Can I carry a baby with fibroids? I've already answered this question. Yes, you can carry a baby with fibroids, but it is a little complicated pregnancy, and the complications which you can expect when you have a fibroid in a pregnancy is early abortions can happen. Then it can lead to an increase in the size of the fibroid because in pregnancy there is a lot of hormones which supply the fibroids. Then it can also lead into something known as a preterm or a premature labor. Then it can also cause intense pain in the lower abdomen, that is known as red degeneration of the fibroids. So it is a little complicated pregnancy, but it is not an impossible one. You can definitely continue your pregnancy with fibroids in place. How do fibroids cause infertility or miscarriage? I have already told you they distort the normal anatomy of the female reproductive tract, and they cause something known as fallopian tube blockage. Plus, they also cause a distortion of the endometrial cavity where the embryo implants. They also produce a foreign body kind of reaction in the endometrial cavity which leads to implantation failure due to inflammation. Can a 3 cm fibroid cause infertility? Yes, a 3 cm fibroid and a submucous one can definitely cause infertility, but a 3 cm intramural fibroid cannot cause infertility. It is less likely. How soon can you get pregnant after the fibroid removal? Yes, very important question. After the fibroid has been removed, you have to wait minimum for a period of 3 months, because the healing time for the uterus to get back to its normal anatomy is 3 months. So after any fibroid removal surgery, whether it is through a laparoscopic approach or through a hysteroscopic approach, the minimum waiting period is 3 months. That is the healing time the uterus and the body requires to recover from the surgery. Can I do IVF with fibroids? No. IVF cannot be done in a woman with fibroid. Any woman who is planned for an IVF has to first get the fibroid removed and then undergo the IVF procedure. The reason being that in IVF we give some external hormonal agents, and these agents can cause an increase in the size of the fibroid, which can again cause problems after your IVF pregnancy results come positive. So all patients who are posted for an IVF procedure, if they are diagnosed with fibroids, they have to get the fibroids removed first and then undergo the IVF procedure for a successful IVF result. Next question is, can abortion cause infertility? I did not get this question. Can abortion cause infertility? No, definitely not. Can fibroids block sperms? Yes, I told you fibroids will distort the normal anatomy. It will distort the normal tube and the ovary relation. It will distort the normal cervical relation with the tube and the ovary, and this it can cause difficulty in the sperms reaching the ovaries by blocking the tubes. So they cannot block these sperms. Basically, they will cause blockage of the fallopian tubes, and because the sperm and the egg meet first time in the fallopian tubes, if the fallopian tubes are blocked, the egg and the sperm cannot meet, and therefore it can cause infertility. The next question is, what is the impact of fibroids on fertility? I told you fibroids distort the normal anatomy, and therefore it spoils the relation of the tubes and the ovaries, does not allow the sperm and the egg to meet, and that is how it affects fertility. It will also affect the intrauterine milieu, where the pregnancy has to implant by causing a foreign body reaction, causing an implantation failure and inflammation. Does endometriosis cause infertility? This is unrelated to fibroids, but I will just answer this question because endometriosis itself is a very vast topic. Yes, endometriosis causes infertility. It is the most common cause, in fact, for infertility nowadays that we are seeing in women. Can being underweight cause infertility or miscarriage? No, being underweight cannot cause infertility or miscarriage. You should neither be underweight nor you should be overweight. Your weight should be average whenever you are planning a pregnancy. How do fibroids cause infertility or miscarriage? I have already explained how do they cause infertility. How they cause miscarriages, they cause increase in the uterine contractions, and because of that increased contractility of the uterus, there is a tendency of the uterus to just evacuate the pregnancy, and that is why they can cause miscarriage. Does a 4-time miscarriage cause infertility for lifetime? All my reports are normal and my body is fit, but one more time I have faced a missed abortion. I am hopeless. If a woman, this is again unrelated to the topic, but I'll just answer this question. If you have faced abortion for the 4th time, especially if it's a missed abortion, and all your reports have been normal, then I think you should visit a fertility expert and get yourself evaluated for a condition which is known as APLA, that is antiphospholipid antibody syndrome, where these recurrent miscarriages are very common, and these women have to be treated differently than the normal population. So please visit your treating fertility expert to get further guidance on this. The other important question is, can fibroids on my uterus affect future pregnancies? Yes, fibroids can affect future pregnancies, mostly the submucous and the intramural. Less likely intramural, more commonly submucous. Can keto diets cause infertility? No. There is a lot of myth on that diets cause infertility. There is no specific diet that can be blamed for infertility, but a faulty lifestyle, bad eating habits can cause infertility. You cannot blame any specific low carb diet or a high carb diet or a protein diet or a keto diet. Your diet should be well balanced, well nourished, and it should be in combination with an active lifestyle, which will definitely improve your fertility patterns. Can I get pregnant with an intramural fibroid? Yes, intramural fibroid can lead to a successful pregnancy. It is a very less common cause of infertility. It's more of a submucous fibroid that can lead to infertility. I think I have answered most of the questions. Any other questions, if anybody would like to ask, I am ready to answer. Thank you.